A man died from it?
Yeah. And so...
Was that the guy that ate the hamburger?
Yeah.
Oh, I saw that.
Yeah.
But I definitely think the stress and the anxiety probably comes from just not understanding or knowing what to expect. I mean, I feel like nerves come with anything that you're doing new.
You know, people will be like, oh, I think it's fine and cute. And she's like, no, here's why it's not. Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know. Okay, I was going to say, like, I really wanted to do something funny where it was like, after, like, Duckwall's babies, like, uses initials, like, you know, AD, you know, like, it's... You know, BC, you know what I mean? Like, uses initials and be like, we're 4 episodes.
Oh, I get it.
You following me now? Okay. What are his initials exactly?
HCD.
HCD. Yeah, that's right. Okay.
I got a picture of him today. He's so cute.
Oh, so cute. Okay, go ahead.
Anyway, we're almost at 400 reviews on Spotify. Apple is, I feel like it just doesn't move anymore.
Who likes Apple anyway?
Apple's at 155 and Spotify's at 396. All I use is Apple.
I know, me too. That's why I'm so confused why it's low.
But those Spotify people, we just saw all those rap things.
Yeah, we're a part of a lot of people's Spotify raps. What's it
Wrapped.
called?
Wrapped? I feel like it's wrapped because when I went to Spotify, because I do use it to listen to some podcasts, and it popped up as a banner and it was going to show me like however many minutes, you know what I mean? You've listened to stuff or whatever.
Yeah.
And so that was really cool. Then you can then share that with people. So I do understand that concept. And then people put it on their stories and we were on there.
I know. We were on a lot of people's.
Which is
so
crazy.
A lot of people listen to us.
That was really cool.
Yeah, it is really cool.
Thanks for all the listens.
We're popular.
Yeah. Thanks for the listens. That's pretty awesome.
Okay, continue to check out our social medias. We have Instagram and TikTok. They're both at the Veterinary Roundtable. We also have a YouTube channel where all of our video podcasts are published, and it is the Veterinary Roundtable. So if you'd rather watch us rather than listen, you should. The most recent one you should probably watch is when Allie and I dressed up for Halloween.
Ooh.
Yeah, that was good.
Because otherwise, I mean, sometimes it is kind of boring to watch. Yeah. Unless you want to see our facial expressions.
Yes.
As we were just talking about.
Yes.
But sometimes it's fun to watch. We need to bring the bag back. She hasn't been witness to the bag before.
That's actually a really good idea.
Or we can do it the first week that Ducky's back.
Yes, we'll do it then too, because that's still like however long from now. But we should totally do it because of Christmas.
Yeah, we should. Okay, so it's, what do we call it? Our mystery bag?
Mystery bag.
So it started when we used to film at the clinic.
Yeah.
Ooh.
And it's just like somebody brings I think, did you start it?
I think I did. Who knows?
I don't remember. But you bring she just brought this bag one day with a whole bunch of random things in it for all of us. And like, it was just the most random things. Like you brought like a toy cat for Devin.
Yes.
And it was like a kid's toy. Like, it's just a whole bunch of random stuff, but it just makes us happy. So it's like little stuff.
So it's a mystery bag.
Yeah.
We're going to do it for Christmas.
Yeah,
I
like
think we should do
last year, Duckwall did it, and she got us all Yetis.
Yep.
And it's engraved with the round table and then our names on it.
Nice.
It's like a little red Yeti.
Yeah, so we'll have to do the mystery bag again before Christmas comes. And
we haven't done it in a long time.
Yeah, we haven't done it for a while.
We also need to do another drink episode.
I was thinking, you beat me to it. I was totally going to say that because at Christmas we should totally do it for Christmas.
Drink.
Veterinary themed drinks.
We made
like red.
It could be red, like somebody you did.
I did heartworm. So like I literally made like a red shot and put pasta noodles in it.
And we drew our drink or our disease out of a hat, and then we had to make a drink out of the disease.
And then we all had to guess what it was.
And then you had to guess what the disease was. You're in?
I had heartworm disease.
Allie's in.
And then the second time I had like a UTI or something.
Yes.
I bought legit urine sample cups off of Amazon. I actually just found them when I was going through all my stuff in my closet. I finally threw them away.
Yeah, it was pretty intense. I mean, they were pretty good. Duckwalls looked absolutely horrible, but it tasted pretty good. It was
No,
Parvo?
you didn't like it.
It wasn't
It
Parvo?
had coffee in it.
Oh, it had coffee in it. Yes, you're right. Was it
Devin?
Parvo? Was hers?
Yes.
Was
the
hers
first time
Parvo?
it was rabies vaccine.
Okay.
And she legit made us all rabies tags.
Oh my God.
And then, I think the second time had something to do with poop.
Yep. I think so.
I can't imagine that tasting good.
Yours was so confusing. Okay, that's why you should go to YouTube.
I don't even remember.
You put all that blue food coloring in it, and it made literally no sense. Wasn't it like propofol? And none of us could guess it because she made the color way too intense. It only made sense to her.
I know it did make sense to me. I don't remember what it was, but I thought it.
Okay, somebody go back.
I know you do. Somebody
go back and fact check this. What did we all make?
Harrison, we need some diseases, and then we're going to pull them out of the hat, and we're going to make drinks for before Christmas. That's what we're doing for the next 2 episodes. Drinks, mystery bag.
You guys should do the mystery bag when Duckwall gets back.
Okay.
And for Christmas, do the drinks and then a white elephant gift.
Oh.
That'd be
White
good.
elephant.
But here's the twist.
Okay.
The gift has to be thrifted.
I love that. Hello. Oh, that's so much fun.
That would be fun.
Okay. So
White
those are
elephant
okay. So we have a
thrifted.
drink. You're going to be in charge of giving us our diseases to.
Does anybody know when Duckwall's coming back?
So, yeah, that's a good question.
Duckwall, if you're listening, when are you coming back?
We need answers.
We need answers. That's right. Should we
Yeah.
call her?
Maybe somebody.
Oh my gosh, yeah, call her right
I'm
now.
calling her. Hold on. Let's see. Let me see her. Let me find her.
You should
Let's
totally
call
be
her.
like, listen, we have a huge emergency.
Okay, I'm going to tell her that. Hold on. Duckwall. She's not going to answer. She's going to be like, I'm on maternity leave. Don't talk to me. No,
I won't be surprised if she answered.
she will. She'll answer. I
She'll
bet she
answer.
does.
She posted that Instagram story the other day.
She knows what we're doing right now. She's still in the group chat.
She does know
That's
that
true.
what we're doing. Yeah.
I thought her Instagram story was hilarious.
Mm-hmm.
Don't forget about me. Listen to the podcast.
I stink.
I stink.
I didn't see it. I'll have to go look.
Oh, she might be sleeping.
Right?
Totally.
Or
She
feeding a
loves
baby.
a nap. Before
loves-
she gave birth, she loves
She
a
loves
nap.
herself a good nap.
When she's not pregnant or
Has been
postpartum, she
forwarded
loves
to
a nap.
voicemail. The person you're trying to reach is not available. At the time,
Yeah, she's sleeping.
please record your message. When you have finished
Or she's tending to her child.
Duckwall, we're trying to call you. We're on the podcast and we're phoning a friend because we need answers. When are you coming back? You're probably taking a nap. Okay, fine. Or taking care of children. Or maybe taking a shower. Any of those things are appropriate. But we still want to know the answer to our question. Okay, goodbye.
It's going to be a good voicemail to listen to.
Okay.
But I think that next week is a guest episode. The week after that is when you guys do the thrifting, the Thriftmas white elephant gift, and then the
Yes.
drink, and then the drinks.
That's a good.
And
that's a good
drinks.
Name.
Yeah, and drinks.
Got it.
Thrift Miss White Elephant.
Okay, we'll figure it out.
Yeah, we will.
Okay. All right. Well,
I'm Courtney Allen,
I'm Dr. Emily King.
I'm Alan McQuarrie.
and you're listening to the Veterinary Roundtable.
Okay.
Okay.
Hits and peaks.
Hits and peaks.
Okay, do you guys ever have like a special pair of pants, sweatpants, pajama pants that you just absolutely love? And
Yes.
then you've worn them for so long and then they get ruined and then you have to just throw them away.
Yes.
And it's so sad. That's my pit for this week.
That's the worst thing to ever happen because I have a pair of pants and I can't find anything else like them.
Yeah.
And
And
so
I-
whenever they get holes in them or whatever, I'm going to be very sad.
And that happens with shoes and it happens with pants
Yeah.
and shirts, everything.
Mm-hmm. So
I
you have to
think
throw your favorite pants away?
well, yeah, pretty much.
You can't get yourself to throw them away?
There's holes in them in inappropriate places.
Well, can't they be a swimsuit cover up?
A swimsuit cover up.
Yeah, it don't matter if there's holes.
Oh, jeez, that's hilarious. Oh my gosh.
I'm sorry to hear about your
Yeah,
pants.
it's
Yeah.
one of those things.
R.I.P.
And my peak is that the mini course live sessions on Saturday, and I'm so excited.
That is
Woohoo!
exciting.
That
Okay.
is exciting.
On Saturday?
Saturday.
Good luck.
Yeah, thanks, man.
You're welcome.
Okay. What do you
For
what
what,
do you
Mom? For what's it for?
Oh, the mini course on burnout is for Vet Practice Pro. And so we're actually doing like a live interactive session where we talk to
Are you going to be
people.
able to see the other people?
Yeah.
Oh, that's fun.
I know. It'll be fun. I'm
So you're not literally just talking to yourself on a screen.
correct.
That's fun.
Yeah, and hopefully these people are going to be okay with being like, so what do you think about? Like,
Well, I mean,
Yeah.
I guess that's why they signed up.
that's why
right?
they signed up. That's right.
Mhm.
So, and someone put to have some laughs. So I got to make it fun.
You're always a good time.
Yeah.
Oh, thanks.
You're welcome.
Okay. All right. So that's what's going on with me. What about you guys?
I don't know that I really have a pit. Never really thought about it today, but peak. We're going to Frankenmuth, Michigan.
Ooh,
That's a
that's
Christmas
coming up.
place, right?
Yeah.
The
Yeah.
Christmas town. She's calling us back, folks. She's
Do you
calling
think
us
she
back.
listened to the voicemail?
Let's
Okay,
see.
Interruption.
Hello, Dr. Duckwall. How are you?
What is up, my people? My ladies.
Were you in a nap and I woke you up?
No, I literally set the baby down in a swing to change my clothes and grab an apple. Didn't have my phone.
You had to change your clothes to grab an apple?
Oh, jeez, I hear you. I feel your pain, sister. I feel your pain. Listen, there was a pressing question about your return, and so we were going to the horse's mouth. We were like, everyone was like, don't know.
Mhm.
Harrison's like, I don't know. We should ask her, and so then that's why we called you.
Oh, wow. I feel so honored, one, to be phoned in on the
Yeah.
podcast. I miss it, an adult conversation. But I would say probably a couple weeks. He's
Yeah.
6 weeks next week.
Oh, that's so exciting! 6 weeks old.
He'll have
is
to
wild.
probably join us in the studio, so he'll be a little more hardy, I would say. So I don't know.
Hardy.
Maybe within the next couple weeks, maybe a Christmas surprise, Christmas miracle.
Christmas miracle episode. And just so you know, because this may be even further motivation, we're gonna do mystery bag at some point,
Thrift miss.
and we're doing Thriftmas, which is we're going to thrift for a Christmas present.
Thrift Miss White Elephant.
Thriftmas. I can't even say all that. Thriftmas white elephant and drink episode.
Oh my gosh. And I'm down for that. I can join in on that.
Yes.
So
So
you just tell me when and where what I have to bring, and I'll make sure we both look our best.
okay.
Well, I'll look a little bit more put together than that video I posted.
Okay. It's okay. You're allowed to. No worries.
Yeah, the bags are not going away anytime soon. The bags are,
I hear you. Well, yeah.
I'll make sure I shower.
Okay. Thanks. Okay. We'll talk. Talk to you later. Bye. Okay.
That's exciting.
So we kind of got an answer. A few weeks.
Yeah. A few weeks.
Yeah.
So we might be able to get her to come in for the episode right before Christmas
Yes.
so that it posts on
Let's
Christmas.
try. Yeah.
Or whenever it posts. But you know what I'm saying.
Christmas is on a Thursday.
Yeah.
Are you going to post? Oh, wait. We don't post on Thursdays.
Right. We post on.
We film on Thursdays. We
We-
post on Tuesdays.
Yeah. So there's that.
Mhm.
Fun times. Okay.
Mhm.
All right, Courtney, what about you? Allie?
Were you
So
done?
yeah. Frankenmuth. We were
Frankenmuth.
talking about Frankenmuth and then she called in. That is a great
Yeah.
Christmas place to go.
Super excited.
When are you going?
We leave tomorrow morning.
Oh.
We're going to the Christmas store first.
Yes.
Last year we went at like lunchtime, which was a horrible mistake, and it was so packed.
Yeah.
So packed.
So are you staying all weekend?
Mm-hmm.
That's so fun.
So excited.
Are you staying in a Christmas themed hotel?
Yes. And they have an indoor water park that they just redid.
Oh
It's
wow.
massive.
Wow.
So I'm so excited.
Okay.
Wow.
It's in with your thing.
Allie, we need updates on the nutcrackers.
Oh, the Nutcracker. She's been stalled. She's been stalled. I got to paint his face, but then he should be done. I have to spray the concealer stuff, but it's been so cold out.
Yeah.
I can't really spray paint in the barn. So,
Yeah.
But he is almost done.
Oh my gosh, that's so
and then
exciting.
I'll have to start the next one once it warms up.
Yeah.
But
That's
almost
amazing.
done.
That's amazing.
That's so
know.
exciting.
Good
It's
for
exciting.
you. That's so cool.
I've been preoccupied with other crap.
So do you know how tall it's going to be yet?
Probably 6 foot.
Yeah.
I haven't put it together yet because I wanted to spray the sealant
Yeah.
so it's protected. But
Very cool.
He's
Does he
almost
have
done.
arms and everything?
yeah.
He's got
Arms, legs.
boots.
Yeah, I mean sprayed paint suits. But yes, he is almost done. I'll have to take a photo once he is all
Put
done.
together.
That's
Yeah.
so fun.
Okay.
Okay. My pit is that we have to work the day after Christmas. The
Yes.
clinic is open and I'm really upset about it.
Yeah. Yeah. That
Like,
is
I'm really, really upset about it.
It is a-
Is it really? That's kind of crazy.
well because
Yeah, isn't it?
because we take off the day before Christmas.
And because we opted to have Black Friday off.
Yeah.
Because I already talked to our practice manager. I said, hey, what can I do to get the clinic closed that Friday? And she said, if we can make an X amount of money that Monday and Tuesday, then she'll close.
Oh.
But it's like a substantial amount of money.
Yeah.
So hasn't the
So-
clinic in the past before, Mom, when you owned it, it was after the day of Christmas? No, it didn't.
No, I mean,
It just always happened to work out.
Maybe
I
I'm
think, on a
thinking about Black
weekend
Friday
or-
then.
we were open the day after Christmas because we chose to be off Christmas Eve. But like in
That's
these
right.
circumstances, when we'd be open on Friday and then closed Saturday, then I've been known
I
to
know.
not be open
I
on that
know.
Friday because it's hard.
It's just one
kind
day.
of,
Come on.
right? That's kind
And
of
we were all like, we would rather work like a half day on Christmas Eve and then have the day after off.
Mhm.
I don't want a bedtime on Christmas.
I hear ya.
Okay.
That's true.
Or come in late. That would be the other thing you could talk about is coming in
The
late.
day after Christmas?
The day after
I
Christmas.
just don't want to go to work.
Well, I don't blame you.
I'm really mad about it.
I'm lucky it falls on my off day.
Did you not? Yeah, I was gonna say. Yeah, it falls on your off day.
Yeah. My off day is Christmas. And it was Thanksgiving.
Oh, sorry.
That's hard when it's that year and it falls.
Yeah,
like
I don't get
that.
like an extra day off,
Yeah.
you know? I mean, Christmas Eve, but it's like, it's just a Friday. People are probably going to be traveling anyway. Like, if people come in for their annuals, I'm going to be mad.
I
Like,
know.
really?
Yeah.
Enjoy your families. Your dog can wait for their vaccines a day.
What's gonna happen is they're gonna come in for the annual, like, also, they ate the Christmas tree, they ate some or whatever,
Yes.
like chocolate. Or
I
whatever.
just, especially with it being a Friday, like, and it's just one day and then we're going to have the weekend. I don't know. It's just really annoying.
I know, it kind of felt weird.
And I'm really upset about it.
It did.
So-
It did fall weird.
Yeah.
You know, I always like when that situations like that happen. I'm always like, okay, well, I guess working a day and then being off 2 more days is something. But at the same time, it's like to your point of like, you don't want to have like the holiday is that the previous day. It's not
Yeah.
like it's the
Yeah.
24th and then you're off on the 25th. Do you know what
Yeah.
I mean? But people would always come to us when we didn't have off the 24th and say they needed to travel
Mm-hmm.
to get to wherever they wanted to go. So then that's how it ended up being the 24th off.
Yeah.
But so we had to make a certain amount of money on Monday and then and Tuesday and Wednesday.
No,
No, Wednesday's
Wednesday's
Christmas Eve. Thursday's Christmas.
Wednesday's Christmas. Wednesday. Okay.
If you are in the Hamilton County area, come to All Star on Monday and
Please,
Tuesday.
we'll work you in. I don't care. I'll triple book us.
Spend your money even
If
if
you
you
do
don't
need a surgery,
Even if your
because
dog
I told
does
Michaela, I
need
said,
it.
okay, so I'm scheduling 17 surgeries each
don't
day.
forget to spay and neuter your pets, people.
Come to All Star, please.
Feed your dog chocolate on Monday. Just kidding. Don't do that.
Just come see us for a nail trim. I'll do nail trims all day long. Like, that's how desperate I don't care.
Oh my
I just want to be closed that Friday so bad.
Oh gosh, that's
Because
hilarious.
then, like, so Christmas Eve is whatever. Like, we'll do my in-laws, and then Christmas Day will be my family. And then my mom's like, well, then we're going to have the cousins over on Friday. And I'm like, oh, well, I work, so it'll have to be Saturday.
yeah.
And I just,
You got to
You-
do the thing where you like prep your sickness for when you call in on Friday. So like you just have a lingering quote unquote
well,
cough
see,
on
I would do
Tuesday.
that, but I already tried to request it off and got denied. And I've already voiced how upset I am about it. So if I
Oh.
called off,
the
Yeah.
triple,
I might
the
get in
triple
trouble.
deny.
Well, that would look bad. You're right.
Yeah,
You're
I
right.
know.
But you know what they do at this is totally not the same because it's not healthcare. But like in a lot of businesses, that's just like the end of the year is just like
Jacob gets an entire week and a half off
they're like we're not in office
from December
Nobody's
to
in office.
January.
Yeah.
Jacob, his company always shuts down
is
for like
Spe-
2 weeks.
Does that happen to Spencer's? No.
Eli Lilly gets off like 2.5 weeks.
Yeah,
Yeah.
Jacob gets like almost a full 2 weeks off every winter.
So are they working on the holiday too?
He works Christmas Eve. He luckily doesn't have to work seconds. He goes in early and then gets off at like 5 or something. And then he's off Christmas, but I'm pretty sure they work the day after Christmas.
Yeah.
They hardly get
Any
anything.
time off.
Yeah.
Or any like it has to be like PTO time.
Yeah, I think Jacob has to work the beginning week of Christmas, but then he has from Christmas Eve up until like early January off.
Right.
That's nice.
It's so annoying.
Gosh.
He just gets to sleep in bed while I have to go to work. It's rude. Anyway, that's my pet. And I'm probably going to keep complaining about it.
It's okay. It's okay. Vent. It's all fine.
Yeah.
It's all
And
good.
my peak is that I decorated for Christmas this past weekend, which is later than I've, like the latest I've ever decorated. But
Yeah.
we were waiting to buy a tree.
And so
We
you
just
got-
wanted to make sure it didn't go on sale for Black Friday. It did not.
Okay, so you got your tree.
I got my tree.
Everything's decorated.
Everything's decorated.
And so now
Looks
you
like
can
the Grinch vomited in my house. I love it.
That's amazing.
And we got a pre-lit tree.
Those I didn't know if I would like
Changer.
it, but yes, I love it so much.
Oh my gosh.
Yeah, my mom has one. We bought my mom
Mhm.
one, and it's really cool. And her lights will change colors. Like
So
you
do
can
ours.
do them different.
We can do like the rainbow, like the multicolored or different. Like our tree has a remote.
Yeah,
I
that's
like
how my
that.
mom's is. Yeah.
Mine's not that fancy. Also, I saw Christmas. One of my in-laws had it. This is next level. It was on a stand that had wheels, and it literally like folded down. Like, and all you did was like hit a button or something, and it
And
would
it
like.
folded
But did it like fluff itself? Like, did you have to fluff it still?
I mean, you probably still had to fluff it
Yeah.
some, but I was like, that sucker is on wheels because I have a 7-foot tree. That sucker's heavy.
Yeah.
And it's in a big giant bag. This thing was all on one stand, rolled on. They wheeled it in. And
That's
was like, bam.
super nice.
I was like, oh my gosh. I was like, how much was that tree?
Yeah.
It was a hefty penny, but I'm gonna have me one day.
Yeah.
That is really cool.
I will say our new tree is easier to fluff than our last one, but our last one is like old. It's my parents' first ever tree.
Yeah.
So it was
So
time
did you
to
put
be
a
retired.
tree in your bedroom and then a tree out in the living room?
No.
No, you threw away the old tree.
I didn't throw it away. I have to give it back to my parents.
Oh, yeah.
They can't throw it away.
Yeah.
They don't want to. No, our bedroom doesn't have the room for it.
Yeah.
And I'm not fluffing 2 trees. Look, I have a battle scar from the tree.
Oh, God, that's hilarious.
Courtney, for any new listeners, why are you decorating the Grinch around your place?
Because the Grinch has a very special place in my heart. So when my brother and I were growing up, the Grinch was like our thing with my grandpa.
Mhm.
He passed away like probably 10 years ago at this point. My dad's dad. So he used to work in Washington, D.C. And so the hotel he would stay at had this like 10-foot blow up Grinch.
Oh,
Like just
wow.
one of like those big decorations. And one day he was like, can I please take this home to my grandkids? Like they would love this. And the hotel's like, sure, you can have it.
Oh my God.
Gave it to him. He brought it home. It was in front of my parents' house every Christmas for like years and years and years. And we were just known as the Grinch house because
Right.
we had the biggest inflatable in the entire neighborhood. Well, my dad patched it like for years and then it was finally not fixable. So he did have to go in the garbage. It was a very sad, I think we all cried.
Oh.
And it was after my grandpa had passed. So it was like our last big
Yeah.
thing with him. And so it was really sad. But it's just always been really special to me because it was me and my grandpa's thing and my brother. So I just
Aw.
really love the Grinch.
That's really cool.
Yeah.
So I'm not on the Grinch bandwagon. I've loved the Grinch since.
So then the Grinch Christmas party theme.
Mm-hmm.
Yeah.
I
you're
know.
like-
I
you're
love
excited
me
about
some-
it.
Yeah. But the OG Grinch, Jim Carrey, not the new ones.
I liked him.
Like I can quote that entire movie.
Yeah, I like
The entire
I do
thing.
too. I like Jim Carrey as the Grinch. I thought he
I
did a great
love
job.
that movie so much.
Yeah.
But yeah, the Grinch is just special to me.
Okay, well that's a cool story.
Mm-hmm. Yeah.
I had no idea about that. I legit thought you were just going to say, I just love the Grinch.
I didn't know
That's
about
fully
that
what I was
either.
expecting.
No, it's like the Grinch is very special to me. So I just love it. I wear my Grinch slippers all year round that Jacob got me a few Christmases ago.
That's okay. You're
Yeah.
allowed to. All right. On to Tales from the Trenches.
Who's reading this
Oh,
week?
boy. I can do it.
Okay.
She's a longin'.
Okay.
Okay. Hi, VRT ladies. I was listening to this week's episode and was psyched when you mentioned the red meat and alpha gal allergy on the pod and wanted to share my story. I'm a small animal veterinarian in Northeast, and this is really close to home for me as my dad was diagnosed with a red meat allergy a few years ago. At the time, I was in vet school, and we happened to be learning about this in class. All the while, my dad was having severe and mysterious allergic reactions, which had gotten more severe over time. What did all of his episodes have in common? They all happened a few hours after consuming various types of red meat, beef, pork, lamb, and some can have reactions to dairy products. He never mentioned or never noticed an official obvious bite, but in the Northeast, our tick population can
yeah.
be excessive, so he must have missed it. The Lone Star tick is also being found in more and more areas throughout the country, much farther north than even a few years ago. After learning about it in school, I mentioned the alpha-gal syndrome to my dad, and his doctor was able to confirm his diagnosis. Had this not been mentioned in class, we may have never had an answer, or at least would have had a delay in care, as this was all so new, and his human MDs didn't quite have this on their radar at the time. I'm very glad it is getting more recognition in the news, and so deeply sorry to hear that it is becoming more common. I think this is a really cool One Health moment for veterinarians and human doctors, since tick-borne diseases impact both humans and pets, and we can all learn from each other. As you guys mentioned on the pod, I use this allergy as one of my examples when discussing the importance of tick prevention. Hopefully one day doctors can know more about how to prevent transmission of this. But in the meantime, spreading awareness is key since there are sneaky amounts of red meat products and things you wouldn't always expect there to be. Thanks for all that you do, Sam.
Oh my gosh, that is so cool.
I didn't even know about that.
Was she not here for the Alpha Gal?
She wasn't. I don't think so. Yeah.
Oh my
That
gosh.
was one of the trending topics.
Yeah, I didn't. To be honest, I didn't look at the itineraries.
Yes, and you know, but he's Northeast, right? So of course, you know, you're going to see some of this stuff even more commonly then. And how cool is it that he learned about it in school and then was able to mention it?
That's like one of those things. Like you were meant to be there.
Yes.
So that's really cool.
So it's a tick-borne illness
In people.
that then causes you to have a red meat allergy?
Yes.
yes.
Okay, so you get bit by the tick and the tick transmits it and then you
Have an allergy to, and I can't remember the mechanism because now it's been
Yeah,
however
it's been a
many
few
Is
weeks.
it curable?
No.
Or do you just have to manage it and stay away from red meat?
It is not. It is not curable.
Yeah.
Yeah, you have
Ooh.
to change your diet.
Yeah.
A man died. Where was it? North Carolina or
New Jersey.
New Jersey?
A
Yeah.
man died from it?
Yeah. And so.
Was that the guy that ate the hamburger?
Yeah.
Oh, I saw that.
Yeah. Yeah. And, you know, he's exactly, or he or she
I just didn't look into it.
is
Yeah.
exactly right from the perspective of One Health. You know, we talk about One Health, or the younger students are being taught about One Health and, you know, like, so how things affect, you know, multiple species. And so this is a perfect example of that.
Zoonotic.
And it is not that people want to make money off of flea and tick prevention.
We're trying to save lives over here, people.
We're trying to save lives.
Like, that's what we're
right.
in this career for.
That's right. Oh my gosh. We'll see some of these comments on social media and some of these things that are like, you know, my animal just doesn't get exposed to these parasites, or I wear this, or, you know, my dog
They only
uses
go outside
this,
to pee and they come right back inside.
you know, and this prevents, it's like, no, this is not going to, yeah.
Yeah, so that's really cool.
Yeah. Very cool.
I mean, not cool for a dad, but
No.
cool that.
But at least they got a diagnosis
Yeah.
and
Yeah.
he didn't.
because I'm sure it's not.
It didn't
super,
didn't turn out worse than it could have.
Yeah, it's not super
Yeah.
prevalent. in
That's
human
very interesting. How
Sam,
that how
thank you
tick-borne
so much
illnesses
for sharing
work, or
that.
any kind of illness works.
Right.
Like that, like you get bit by a bug and then all of a sudden you're allergic to meat.
Meat.
Yeah,
Can you
that's wild.
imagine?
That
Yeah.
would also be very sad.
And then like what she was saying, it could be in things that you have no idea it's even in. Ooh.
Yeah. Yeah.
Ew.
Yeah. Like, wouldn't you be scared to eat moving
Yeah.
forward?
Yeah,
You probably would just eat fruits
because I mean,
and
meat's
vegetables.
everywhere.
If
I
you
mean,
wanna
he
get
probably
in-
has to become somewhat vegetarian of some. I
Yeah.
mean, fish isn't red meat, but
Yeah.
If you want to get tested, come to All Star on that Monday or Tuesday.
come get your flea and tick prevention on Monday and
That's
Tuesday,
right.
please.
That's right.
Make sure you and your family are covered.
That's
We have
right.
Simparica Trio and
It's-
Simparica,
Yes.
And for our
please.
12.
Oh my gosh.
and we'll
please.
throw in a nail trim.
And we'll throw in a nail trim. That's right. Oh, jeez. Okay. Thank you so much, Sam, for that story.
Yeah,
that
I'm
was,
glad your dad's okay.
that was really cool.
Yes.
Yeah. All righty. Continue using our text message feature for our podcast. You will tap on the episode in your podcast provider of choice, which seems to be Spotify. You look at the top where it says send us an inquiry through a text message here. You click that. You can text us anything. You can text us the Tales from the Trenches. Well, I think that we want those emailed. But if you really want to, you can text them. You can text questions, comments, concerns, anything like that. And then we are also now taking voice message inquiries. So you can actually send those voice memos to the veterinary roundtable at gmail.com.
Yes. We love the voices.
We do.
The voices.
We love listening. Okay. First one.
Okay.
Hi, Veterinary Roundtable. Your podcast has really helped me understand a lot of my veterinary questions as someone who isn't in vet school yet. I've just started my journey in the field and have been doing some shadowing, which has been really interesting. Recently, I had the opportunity to restrain a rabbit for the first time. The vet showed me how to do it and emphasized that I needed a strong grip so the rabbit wouldn't accidentally break its back. That moment was honestly pretty scary. I wasn't sure if I was doing it right, and I was really afraid of hurting the patient. I think part of the struggle was that the quick lesson I got felt a bit rushed and overwhelming. That same day, I watched another vet restrain a very spicy cat. It also seemed a little rushed, and both the vet and tech weren't wearing gloves. The vet I was shadowing mentioned how dangerous cat bites can be and how every vet gets one eventually. I know no one wants to get bitten or scratched, but hearing that definitely freaked me out. So I wanted to ask, how do you cope with the stress of being in a position where you're helping an animal, but you also have the potential of accidentally hurting it? And do fears like getting bitten or scratched fade with experience, or could this be a sign that VetMed isn't the right path for me? Thank you for everything you do. I really appreciate your insight. Thanks so much, Sarah. That's a good question.
I really like this question.
Yeah.
I do too.
Okay. You want to start out, Allie?
Oh, sure.
Okay.
So I would think, okay, there was kind of a couple questions in here. Where'd it go? I think
How do you cope with the stress of being in a position where you're helping an animal, but you also have the potential to accidentally be hurt or accidentally hurt it?
the patient?
Yeah.
I guess this is kind of a roundabout answer, but I think educating yourself, like animal behavior is like really important to me. And so I think taking a class or something, because I feel like once you understand the animal's behavior, you know a lot more. I
As
feel
in
that
like body language, right?
Yeah, body
And-
language. Like body language is so important. And definitely like the rabbit thing, that is scary. Like
I still am scared by rabbit
Yeah.
restraint to this day as a veterinarian.
I got
Like,
to be our exotics vet last week, and it was a little. I mean, if
It's
they
nerve-wracking.
can jump one wrong way.
right. Like, and it's probably, we make it more dramatic probably than
Yeah.
it is. Like, and I think if you're doing it correctly, the probability of that happening is really low. But because when somebody says something like that, it's not like they'll break their nail. It's like,
Well,
oh no,
you're-
they'll break their
Well,
back.
then you're even more on
you know?
edge, and then you're
Right.
tense, and
Right.
yeah.
But I definitely think the stress and the anxiety probably comes from just not understanding or knowing what to expect. I mean, I
Mhm.
feel like nerves come with anything that you're doing new, but I think definitely knowing the behavioral signs definitely helped me.
Yeah. I definitely think you should always, or you should never do something that you're not comfortable with. And I mean, you always have to be uncomfortable or be comfortable being uncomfortable. But you also, I think, especially like with exotics, like if you're just like, I don't know if I should hold this bunny or this rat or what. I mean, they're squirmy little things. So you could always ask for help or have somebody like demonstrate, because I feel like watching somebody
Mhm.
hold can also go a long way, rather, because I feel like sometimes, especially with restraint, it's hard to like explain in words how to hold an animal sometimes. So I think if you're uncomfortable, just ask somebody to do it for you, watch them, and the more you do it, the more comfortable you get.
Allie, is there a time that you can think of off the top of your head where you did have those behavior cues help you in a situation like what you're describing?
Oh yeah, like I would say dogs, well even cats, like when their ears are pinned
Mhm.
or they start grumbling, like I never, like I don't take it personally. I don't care if I get judged for putting a muzzle on a pet. Like I'm putting a muzzle. If they're giving me signs like ears back, growling, or whale eyes, like you're seeing a lot of the whites of the eyes, like
Cat tails.
cat tail, like if they're flicking their tail, they're mad. Like I don't, as long as it's obviously not going to make them worse by
Mhm.
putting the restraint method or whatever you're using, a muzzle or a happy hoodie or whatever you're using, as long as it doesn't make them worse, then I always do it. It makes me feel more comfortable. We can get our jobs done. And sometimes that's better for the pet too.
Mm-hmm.
So
Use your tools you have.
yeah,
Mhm.
I'm never afraid to muzzle a dog.
Yeah.
Like
I think with the new like fear-free stuff, there's plenty of information out there on how to make the experience better for the patient.
Yeah.
So you have
Yeah.
all those resources related to that aspect of veterinary care that is new from the past like several years. But then there's a great person on Instagram that is Thinking Canine. We had her on the podcast, and she does a great job because what she does is show videos of behavior
Mm-hmm.
and then says, "What do you think?" And I mean, she answers the question, but people will be like, "Oh, I think it's fine and cute," and she's like, "No, here's why it's not." And she
Yeah.
shows you things about the animal's posture, what it's doing, why it's doing what it's doing, and this is indicating this. And so, like watching that type of content that is good content that is reliable and educational and accurate really goes a long way, And I think the more you're around normal patients, patients that are happy patients that act in a normal fashion, right?
Mhm.
The easier it is to recognize those that are like not okay,
Yeah.
right? So, like you have a golden retriever in a room, they typically aren't under a bench hiding
Yeah.
from you. Like that's your clue that something not right here,
Yeah.
kind of a thing. Like, and so I think starting to see more and more normals and then understanding some of the breed commonalities that we see with personalities, and same thing with cats. We joke about that with cats and colors of cats and personalities linked to colors of cats, but it's true.
Yeah, very true.
And I think that can make a big difference too.
Yeah.
Recognizing and learning that information.
Yeah.
Do you guys think that when she says, I know no one wants to get bitten or scratched, but hearing that definitely freaked me out. Do you feel like as a person working in the field that you will eventually get bitten?
No,
I don't feel that way at all.
That should be just like a expectation.
Yeah,
of being
I
in
don't think so at
veterinary
all.
medicine.
Yeah.
Like, I mean, I think that they could have worded it as there's always a risk that you could get injured because of the job. We're working with animals.
Yeah.
And you will occasionally come across an animal that gives you absolutely zero warning signs.
And totally surprised you.
Yes, like the time my one bad bite, the dog was completely sedated and out of nowhere woke up and latched onto my arm. The dog wasn't even awake.
Yeah.
So but I don't think it should be an expectation by any means. Like you don't, like I said, if you practice, like you have all the safety tools that you need and you know how to handle an animal and you know how to take body language, you know how to look for cues, then I don't think you should just be waiting. Like, when's my day going to be where I get injured at my job?
The only time I ever got bitten was by a ferret.
Yeah.
In 30 years or however long it's been. And it was when I was first out of school. I was up in South Bend at Kreider Veterinary Clinic, and a ferret came in, and so I was working on the ferret, and I was just petting him or whatever, and it latched onto my finger. Yes, exactly. It took all of my willpower not to be like, boom, and I was like
against the wall,
taking, because it's sharp teeth, It was not a big deal. Nothing bad happened or anything, but that was the only time I've ever been bitten. I had a dog lunge at me once, but didn't get me. But I think because I take your stance as well, probably like you too, Courtney, like where you're just overly cautious. So you just
don't put yourself in a situation to get bit.
Yeah.
Or to get hurt.
Yeah. I was gonna say I don't remember a time that I've gotten like bitten like bad. Like I've been like chomped a little bit, but like nothing crazy. But I think comfortability.
Yeah.
A little bit more time in the feet.
I don't think that means that you need to avoid the industry either.
Yeah.
No.
I think she asked that question,
you're going
right?
to be nervous about so many different things. That's normal.
Yeah.
Yeah. Could this be a sign that vet med isn't the right path for me? Nah.
No. Or like she talked about like being scared to break them. Like I feel like that's a common fear. Like when you're not sure, like how much pressure to put or whatever. Like I just feel like you learn that.
I just feel all these things, they all come with time.
Yeah.
And experience.
Yeah, and the smaller the animal, the more scared you are. Yeah,
I wouldn't say you'll get less like sensitive, but you grow tougher skin and you understand how to hold different patients and how much restraint they actually need and when drugs are needed.
Yes, yeah. Don't be afraid of the drugs. That's right.
Yeah,
exactly.
No, I think you'll do great.
Thanks for the question, Sarah.
Yeah. Go ahead, King. Next one.
Okay. Hey all, I thought this might be too lengthy via text, so email it is. Recently, I came across Dr. King's reel on spaying aborting pets and if the patient is pregnant while being spayed. At our clinic, we had a client bring in 2 of their dogs, a GSP and a Pyrenees mix, to be spayed, knowing they were bred. We charged an additional cost if the patient is in heat or pregnant, so this is not something uncommon for our clinic to see, unfortunately. In the words of the client, we would rather pay the extra than to have 20 puppies. The Pyrenees was almost full term. We continued with the procedure in block spay, but when they are that far along, it makes me, I guess, uncomfortable is the word, knowing the puppies were viable. We knew she was far along, but we didn't realize how far along she really was. Dr. King, you mentioned in your reel that if pregnancy is more advanced, then you don't proceed with the procedure. Does the whole All-Star Clinic hold the policy that if they are far along in pregnancy to not go through with it, or is it a personal choice / conviction? Secondly, if mid-procedure you realize the patient is further along in the pregnancy than was thought, what does that conversation typically look like with the client? Have you had any pushback and the client still want to spay done? Anyways, that's enough rambling on my part. I hope that all made sense, and I look forward to hearing your thoughts. Love the podcast, and I hope you all had a fantastic Thanksgiving. Aubrey.
Yeesh.
Have we done a spay on a full-term dog?
No, I was gonna say I don't know if we've even ever seen a dog that
No,
far
we
along.
had a client that wanted us to do it, but we told them no.
No.
I think most of the vets
Said
kind of
no.
have the same
Yeah.
stance.
Yeah.
However, we did have a dog come in, a corgi, and they thought she was just in heat. They wanted her spayed. She ended up being pregnant, and the owners had no idea that she was pregnant. And I mean, we did just spay the dog. I mean, she was pretty far. She wasn't full term, but they were formed, which it stunk. But I mean, at the end of the day, the client wanted the dog spayed. That was their goal. I don't know. I think it's kind of silly to call, hey, your dog's actually pregnant. You want us to close her up? I don't know.
Yeah.
It was kind of a weird situation, but.
Yeah, I mean, I think that you're, by the time you're in the procedure, you're almost too late, right? Because all those fetuses are having the anesthetic gas.
I was gonna say you gave the
gas and
mom all the
meds.
drugs.
Yeah.
Like when we do a C-section, our drug protocol is very different than a normal anesthetic procedure.
And I think that we use the term they're far along, but how many times have we had C-section puppies where the owner misjudged the days, right? And you're thinking it's between 63 and 65 days, and those babies are born and they look almost full term, right? They're 62 or 61 days and they don't survive.
Yeah.
So, that's really hard to know. And I suppose if you knew they were 65 days and you knew that you're doing that spay and you're going to then take those puppies and they're going to be orphans and you're going to, we know what that's like, right, Allie?
Yeah.
It's really hard to make those puppies survive, but say that's the approach that your clinic's going to take, then that's fine if they're at 65, 64 days, maybe 63. But we haven't had any luck with puppies born much earlier than that, and then especially orphaned on top of that, like say a mother dies and then you have orphan puppies that are that age, so I don't know. I guess my caution is that it may be that they're not viable. Like we're using the word viable, but they may not be viable, and that doesn't make it okay, and that's not going to make it feel any better.
Yeah.
Although in my head it makes me feel better that I'm not euthanizing an actual viable puppy.
Yeah.
I think.
What do you guys think?
I agree with that.
That's hard.
I mean, I think it's anytime you spay a pregnant female, I feel like it's gonna suck a little bit. Like your heart's gonna hurt because those are babies. Even if they're not viable, it still sucks. But at the end of the day, like you said, I mean, you're reducing the risk for the female. Like, I mean, if that's the owner's goal, then that's the owner's goal. And
I mean, King's point,
I think it would be different if we had an owner come in and straight up know, like, hey, my dog's pregnant. They're gonna be due soon, but like we need to get her spayed. Like, I think the most frustrating part is the irresponsibility of the owner. Like,
and so then the owner's being responsible by spaying the dog, and also
not wanting puppies. Yeah,
and so then it's like, even though it may not be what's right for. Yeah. For in your heart to do, that's hard to separate that.
But yeah, I don't have much experience with having to deal with that often.
I agree with you though, Allie. I think it's a clinic stance. Like I think the type of veterinarian that is employed with us typically all feels the same way. Yeah. I don't think somebody's going to spay a 65-day gestation female.
Because the vets have to sleep at night with knowing what they did too. So.
Right. And again, because at that time period, you absolutely know that they're viable. And so then we probably, and I don't know how you so to me, I'm like, how would you know that they're 65 days? Like, why would you then spay the dog? See what I'm saying? Like, if you knew they're 65 days and you're in the middle of an anesthetic procedure, then your first mistake was undergoing the anesthetic procedure, right? So there's no way for you to be in that situation and know that they're 65 days. Is this making sense? Am I making sense? No, kind of, sort of.
I think so.
Well, like the owner didn't know and they just said spay my dog that's super pregnant.
Right.
But then they don't know when the dog got pregnant.
Right. So you as the veterinarian know that the dog's pregnant. So then at that point, you have to decide, am I okay spaying a pregnant animal or not? Because there's no way for you to know that they're full term.
Right.
You can't get in there and then...
Unless they're actively in labor.
Right. And see a dog that has hair and go, oh, they might be full term. I'm going to try and save them. And they end up being
Yeah.
a hot mess express.
Right.
Yeah.
And all those drugs. You're so right. I didn't think about it. But like all those medications, like
Are
a lot
not
of those-
pregnancy safe.
No, and even like when we do our protocols, some like the last puppies that are in there are so hard to wake up, and they sometimes don't. I mean,
Yeah.
But yeah, now that you say that, the last ones to come out.
And we're
They're-
talking about like,
Because the mom's
it
not
takes
there
us 7 minutes, 8 minutes at tops, 10 minutes at tops.
to get all the puppies out.
Yeah. I mean, it's fast.
And and sometimes they don't make it.
And you're like, and we don't use any drug. I mean, like
Yeah.
literally. I mean, you're using blocks, you're using like
Yeah.
things that aren't going to be absorbed by
Yeah.
the puppy. But I mean, you don't have a choice. You have to use an inhalant. We use an inhalant. So
Yeah.
the puppies are getting the inhalant.
But we move as
I
quick
can't
as
imagine
possible.
doing a spay and you're just clipping. Do you know what I'm saying? Like
Yeah.
you're just doing
There's
your
no
regular.
urgency.
Those
there's no
puppies would
urgency.
never probably wake up.
Right.
Yeah.
Right. So I think, I don't know, we've been talking in circles because there's so many different like
Mhm.
ding,
Yeah.
ding, 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 like right little avenues
Yeah.
to this scenario. Yeah, I think it's really hard because as the veterinarian, as the clinic, you're trying to support the owner. And so how do you do that? They're making a responsible decision to spay the animal so they don't have these million puppies that now they don't take care of.
Yeah.
I
That's
don't
also
know.
true.
But then do no
It's-
harm.
But then, right. I mean, there's all these caveats.
Mm-hmm.
That's hard.
So
I'm sorry.
I think it's just a crappy situation
Yeah.
altogether.
It truly.
yeah,
You just got to see the good.
see
Even
the
though it's
good,
really,
even though it's
really
hard. And maybe just develop a policy for your practice that you guys can live with
Mm-hmm.
and feel good about,
Yeah.
so that
Don't
you're-
set yourself up to be in that situation.
right.
Maybe.
Yeah. So that then you feel like you're in control. The more in control you feel, the better you're going to feel about the decisions that you're
Mhm.
making.
Yeah.
So maybe that would help too.
Yeah.
So hard.
I think we hit on all of it. But as we were talking, a little off topic, where's case collections?
Yeah, you guys got to do case collections now.
Oh,
It's not on our
it's not on our
itinerary, sir.
itinerary. We skipped it. Okay. Oh my
It's
gosh.
not even on here. But I was like, wait a minute,
I'm
we're
pretty
missing
sure it's right
something.
before the listener questions.
Oh, is
I
it?
just think
'Cause
this
no,
is
it's
funny
not.
because Aubrey says, that's enough rambling on my part. So that's kind of, we're like, that's enough rambling on
I
our
know.
part. Okay.
No, there's no case collections on here,
Yeah.
Harrison.
All right.
No, it's there.
It's
Where?
there. It's there. It's
Harrison,
there, he
where?
says. Okay, go ahead, Courtney.
Okay,
Fill
I'm
us
gonna
in on your case.
Okay. I have a novel and a half of papers here.
Okay.
Oh my God.
Oh, wait.
What?
Before I start, I have a PSA
Okay.
that I have to give given the holiday season.
Okay.
We had 2 cats come in recently that were hospitalized at an ER clinic for multiple consecutive days because they got into a broken snow globe and ingested the liquid inside of snow globes. Do you know what's in a snow globe?
No.
Because I had no idea.
No.
Antifreeze.
Really?
Who would think?
Antifreeze is
better
in
than antifreeze? You could put in
side snow globes.
Shut the front
It
door.
was Dudley's case, and because I mean the cats were sick, like very, very, like they almost died. And so Dudley somehow pulled that factoid out of her butt because she's Dudley. But yeah, snow globes have antifreeze.
And that's the only thing we can use in snow globes is antifreeze.
I'm like, there's so many. Alcohol.
Christmas decoration?
I mean, we have AI now. No, I'm just kidding.
I know, but I'm just putting a PSA out there.
Okay,
my
that's
gosh,
a
don't
great
break
PSA.
snow globes
That is a great PSA.
with your animals. Don't let cats play with them like toys
Okay.
because it can kill them.
Yikes.
Antifreeze is very scary and dangerous.
Wow. I
Who
never
would've
would have known
guessed?
that.
I know. I was like, I told myself that on the way here. I was like, Courtney, don't forget to say
This
that.
is fantastic. That is
Wow.
great, Courtney. I love
Mhm.
that.
know.
Antifreeze?
I know. Anyway. Okay. So my case is a 13, 14-year-old beagle mix. So we're going to literally go all the way back to the start.
Okay.
So January of 2025, she presents for a rapidly growing spot on her back that had been present for several months prior. The spot is now painful when the owners touch it, but the dog's acting completely normal otherwise. So there was a round, firm, quarter-size subcutaneous mass on the mid-dorsum at midline. And she has other bumps everywhere else, but those are historical. So we did an FNA of this particular mass on the dorsum, and it showed 2 mast cells and 1+ round nucleated potential
Mesenchymal.
Yeah, cells.
Okay.
So, Dr. Duckwell at the time just recommended surgical removal of the mass with margins and histopathology because the dog had actually had mast cells in the past. So, all right. Anyway, so moving on to, so this was January 10th she came in for it. And then we did end up going ahead with the surgical removal of the mass. So like I said, we had saw all the mast cells, so we sent it out for histopath just to double check ourselves, make sure we got good margins. It came back as a soft tissue sarcoma.
Okay.
And it said that we had complete excision, but with these masses and where it was, they can infiltrate locally and reoccur if incompletely excised, with reoccurrence rates, regardless of grade, ranging to 33.3% to 41%. So what we were concerned about when we explained to the owners is that it could be deeper, like seated deeper, not like we got around it, but you can only go so deep into the muscle.
Yeah.
So the owners were really hung up on the 33 to 44% of reoccurrence. So moving on to the beginning of February. So let me backtrack. So we told them the histopath results, was we were all kind of blown away. Like nobody suspected it to be a sarcoma. And so after Dr. Duckwell had relayed the histopath results to the owners, we gave them the option of like further workup. So like staging, just in case it had moved anywhere else. So like the chest x-rays, the whole thing, or going to oncology to see if they needed to do any kind of cancer treatment. Or the third option was going back in and trying to scoop out as much as we could, but then also knowing that we don't know if we're going to get everything 100%. So we presented all of that to the owners, and the male owner actually inquired about the use of ivermectin as a method of cancer treatment. So we went back and forth a lot with them and just explained that there's really not a whole lot of studies done on. I don't think there's any studies done on it, but that we just didn't know that how it would work and if there was any point in doing that. So after they had talked to us about that, they did let us do the chest rads just to make sure that there wasn't anything there prior to proceeding with any kind of treatment. And so her lungs were clear, just old dog lungs, because like I said, she's 14 at the time. But everything else looked pretty normal. We then again talked to them about the scar revision, all that kind of fun stuff. But the ivermectin conversation was like the main thing that they just kept hitting on. So Dr. Duckwell, I think the female owner came into that appointment, but then the male owner wanted to call and just further talk about the ivermectin treatment. So Dr. Duckwell went back and forth with him a lot about it, and they ended up declining to do the scar revision. So they just didn't want to put the dog through a whole nother surgery because it took her a little bit more longer to recover from the anesthesia itself. So they declined that, and I think at that time we hadn't started any kind of treatments or anything like that, like any medications. So fast forward now to July of 2025, the dog presented again with a fast-growing mass under the left side of her jaw. Dr. Jones saw her for this, and it was her left submandibular lymph node. It was palpable, and it felt distinct, and it was separate from the adjacent masses. So she did a fine needle aspirate of the left submandibular mass. Cytology revealed questionable round cells, occasional neutrophils, occasional red blood cells, and 1+ cocci bacteria. And let's see. So knowing that she had history of the sarcoma, there was potential incomplete margins, all that kind of stuff. So she talked to the owner about that. So she did the in-house cytology, but then decided to send out cytology to the lab just to confirm. So in the meantime, they started her on Cefpaderm just for any kind of infection, if that was what was going on there. And then the cytology came back. I'm pretty sure it was inconclusive the first time. So then the owners had to come back again to get the mass resamples. So then the recheck, cytology showed, it says the slides are moderately bloody and cellular. Significant numbers of intact lymphoid cells are seen, predominantly intermediate lymphoid cells with far fewer small mature lymphocytes and intermixed large and immature lymphoid cells. And then rare plasma cells are seen. So, given that information, there's so much information in this case. Let's see. So we relayed those results to the owner. And at this time, so in July, the owner then brought up again ivermectin. And so we decided to just start that because that's just what he wanted to push for. And he wanted to give it a shot because at this point, it's not going to necessarily hurt the dog. We don't know if it's going to help. So we started her on ivermectin, and the owner actually did a lot of research on his own and like found dosing recommendations and all that kind of stuff. So at this point, we kind of just let him drive the car on her treatment. And so he would present us with the information that he found, and then we would calculate the drugs based off of what he found.
I think he did fenbendazole too.
Yes. Yeah.
Right?
We prescribed that at the same time. Yeah. So we started ivermectin, prednisone, and fenbendazole. And then, so we started that in like mid-July of 2025. And then in August, he completed the fenbendazole and ivermectin dosing, and just kind of called looking for next steps on where to go from here. And we then, relayed that there's still no platform or research to support this kind of treatment. There's no specific timeline that we can give the owners for something like this. So the plan was we could resample the lymph node that was enlarged and see if the result has altered. And Dr. Duckwell wanted to do that recheck cytology 3 to 5 days after completing the medications. So I called the owner and explained that. And then we scheduled them to bring the dog back mid-August of 2025. And so the owners reported at that recheck that the submandibular mass has become softer and smaller during the previous treatment course. He estimates the mass is currently 50% smaller than its original size, but has become more solid and has increased in size by about 25% from its smallest point during treatment. So we definitely still were able to feel the mass. So it sounds like I think it went down and then maybe went back up a little bit after stopping medications. So I don't know if they resampled it.
No, I don't think so.
I don't think they did. Oh no, they did resample it, and
A
they sent
third
it out
time?
again.
A third time?
Yeah.
Okay.
And at this appointment too, she had some right hind lameness and weakness, but that's just a whole different thing. We're not going to go into that because it's a lot of information. So we resampled it, and this one contained lymphoid cells mixed with blood, many cytoplasmic fragments, and bare nuclei. So we called the owner, and it said, unfortunately, it was mixed cell inflammation and possible lymphoma. Yes, so that's what that one showed. So then the owner at that point wanted to restart fenbendazole and ivermectin, and doing it for a longer course of time to see if that would help anything. We also gave him different options of a sedated biopsy of the mass for a definitive diagnosis prior to restarting meds, or restarting meds and then do the sedated biopsy. But that second option, after starting meds, it can alter the results. So in the end, the owners decided to go ahead and just start the medications, because I went back and forth with the owners often of like the biopsy, and yes, they could go through all of that and put the dog through sedation, and it's a little bit more money to spend, but what were they going to do with the information? Like they were pretty against any kind of chemotherapy or referring out anywhere at this point. So like I said, we went back and forth, and then at the end of the day, we decided they just wanted to do meds and keep her as comfortable as possible. So we restarted her on ivermectin and fenbendazole. And then in September of 2025, she presented again for a recheck of previously identified neck mass suspected to be lymphoma. The owner reported that the mass on her neck has been decreasing in size since starting steroid therapy. Her appetite has been kind of on and off. She has good days and bad days. But then everything else, she's doing pretty good, and she still has the weakness in her back end. At this appointment, there was actually a grade 2 to 3 out of 6 heart murmur noted. So that was a different change. And then Dr. Duckwall's exam noted that the sub-Q mass of the left lateral aspect of the neck had reduced by 75%, and then all of her other peripheral lymph nodes were normal. So at that point, she was doing pretty good, all in all, given or considering. And then October, the owners had reached out just to give us an update, letting us know that she was doing really, really good. Her lymph node swelling, according to them, was completely gone, and had been at this point for about a month or two. Her energy levels were up significantly. She was eating really, really well without missing any kind of meals. And so then the owner asked about maintenance dose of ivermectin and fenbendazole, and I think we did end up giving, we gave him a maintenance dose of, the prednisone. And then I think we ended up refilling the ivermectin and fenbendazole just whenever he would ask us to, because that's what he wanted to do for his dog. And that's what made him feel better and made the dog feel better. So now we're in November of 2025. And she comes back in, she's 14 and a half at this point. So she presented for evaluation of a lump on her right scapular region that had recently ruptured. And so I think that ended up just being a cyst. So wasn't anything too crazy. Luckily, it wasn't like another lymph node or anything like that. So then a few days later, she came back to the clinic for coughing. She saw one of our relief veterinarians. The acute onset of the severe coughing had begun the previous night prior to bringing her in. The cough was significant enough to keep the client and his wife awake all night. And so the relief vet offered the full shebang of chest x-rays and things like that, especially given her history of cancer. But the owners elected for conservative treatment. So we sent home meds and said if she doesn't improve, she needs to come back for chest rads. So fast forward a week after that appointment, she comes back because she's still coughing with no resolution. And she still has that heart murmur. But the chest x-rays unfortunately revealed multiple well-defined soft tissue opacity masses throughout her lungs, which was consistent with neoplasia. And then, like I had said, so when we first diagnosed the sarcoma, we did the chest rads, everything was normal then. So this was
been
new.
About 10 months or so, right?
Yeah, because it started in February, and then we diagnosed this in November. So we told the owners it's probably metastatic, it's from her initial sarcoma. And we offered to, so we started her on prednisone because steroid can't necessarily hurt. It'll just help keep her more comfortable. So they did that. And then we actually, the owners discussed the interest of restarting fenbendazole and ivermectin. But it was explained that if they were effective, then this necessarily shouldn't have happened. So Dr. Dudley presented them with a whole bunch of different options, and they actually requested a referral to an oncologist. Shoo.
Yep.
I don't know what happened after that because I haven't looked at her chart, but after...
Well, she went to the oncologist.
Oh, she did?
Oh.
Yeah, she went to the oncologist, and they went through all the treatment options that they had, and they decided, no, we're not going to do any of the traditional, therapies, and so the oncologist, so basically they left there saying, we're not going to do any, protocols per se.
Sure.
They did talk about, I think, Palladia potentially, but they, after reading into that a little bit, they decided, no, we're not going to do that either. And so he actually did more research and found that the UC Davis Vet School had done a research study on interleukin 15, using it aerosolized in the nose for pulmonary metastatic disease, and wanted to find out if there was a way to get that drug. And so I had to call UC Davis to say... Oh,
so you got mixed into this too.
Yes, because I know them from way back in the day.
Yeah.
And so, I couldn't talk to the people at UC Davis at the time, so I had to leave a message, and then they were going to call back to the clinic. In the meantime, he wanted to potentially restart the ivermectin and the fenbendazole. The fenbendazole, I don't really have a problem with. The ivermectin at particular doses, I mean, it is toxic at, like if you go up in dosing, we could cause neurotoxicity and with it. And so I was like, you can do it, but there is no, you are using it at the dose that we can use it at. You can't increase it. You can't. The fenbendazole dose was appropriate. You can't really, it doesn't make sense to increase that. I mean, you can refill these if you want to, but they're unlikely to be doing anything. And so he had a hard time understanding the difference between the three medications, right? The pred, the fenbendazole, and the ivermectin, and which one potentially was helping the scenarios. And I was like, probably a lot of the pred, because it's anti-inflammatory. It's chemotherapy, in a sense.
We use it in our chemo protocols.
Right. And so I think he wanted to restart the prednisone, but I don't know. That was last week, and I don't know where, or right before Thanksgiving. So I don't know where it got left off at this point now, because I had to transfer it back to Dudley. So I don't know what's happened at this point.
Yeah,
she has not texted me, so I don't know what.
I figured they were texting you throughout this whole process, but
yeah. So
it's just been a whole, almost like a
and
whole
I think
year
the two
since all this
owners
started.
are struggling because I think they're wanting to handle this differently.
Yes, I would agree. Yeah.
And so, so I think that's part of the wishy-washiness, if you will. Yeah. So anyway. That's my 2 cents on the Yeah, it is. It's.
I know. That's why I know it was a lot that I just said, but it all matters.
It's a very interesting case, though. I mean, and it shows progression of disease, and it shows, I mean, there's a lot of things that you can see in that particular case.
Yeah.
So anyway, it's a very interesting case for sure.
I think we're good with one case.
Yeah.
Good with one case. That's right. Exactly.
That was like King said, a humdinger.
Yeah, I know. Okay. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.